concerning new development has emerged. The mosquito-borne virus that led to strict COVID-era restrictions in China is now making its way into the United States. This alarming situation has health officials on high alert. And here's why you should pay attention. In August, health authorities in New York confirmed that a woman from Long Island had been diagnosed with chikungunya, a virus that can cause debilitating joint pain. What makes this case particularly worrisome is that the woman had not traveled outside of Long Island, which is home to over 8 million residents, including the famous Hamptons. This raises the possibility that her case could mark the first instance of locally acquired chikungunya in New York State's history. Chikungunya is transmitted primarily through the bites of infected mosquitoes, particularly the Aedes species. The symptoms can be severe, often manifesting as sudden and intense joint pain in the hands and feet, which can persist for months, severely impacting a person's ability to move normally. Since the start of this year, there have been over 317,000 reported cases of chikungunya and 135 related deaths across 16 countries. The virus has been present in various regions, including the Americas, Africa, Asia, and Europe. A significant outbreak in China, which saw more than 10,000 cases, prompted the Centers for Disease Control and Prevention, CDC, to issue a Level 2 travel warning for Guangdong Province, the epicenter of the outbreak, back in August. In response to the chikungunya outbreak, China implemented measures reminiscent of those seen during the COVID pandemic, including quarantining patients in hospitals and cutting off electricity to residents who failed to adhere to health protocols. This has raised eyebrows and sparked discussions about the balance between public health and personal freedoms. In the United States, chikungunya is classified as a nationally notifiable condition, meaning that health authorities can voluntarily report cases for national tracking. While the U.S. typically sees a few cases each year from travelers returning from high-risk areas, local transmission has not been reported since 2019. However, with millions of passengers flying internationally daily, the risk of mosquitoes in the U.S. biting an infected traveler and spreading the virus locally is a real concern. A spokesperson from the New York Department of Health stated that they are currently investigating this potential locally acquired case of chikungunya. They emphasized that no locally acquired cases have ever been documented in New York State, and the overall risk to the public remains very low. The department is collaborating with local health authorities on Long Island to verify the patient's test results, and so far, local mosquito surveillance has not detected the chikungunya virus in the area's mosquito populations. Historically, chikungunya infections surged globally between 2004 and 2005, infecting nearly 500,000 people and leading to a worldwide epidemic. Diana Rojas Alvarez, a medical officer at the World Health Organization, remarked this summer that we are witnessing a repetition of history, alluding to the earlier epidemic. Chikungunya is most prevalent in regions such as Asia, Africa, and South America, but recent cases have also been reported in Europe and the U.S. The virus can lead to symptoms like fever, joint pain, and potentially life-threatening complications affecting the heart and brain. Interestingly, the CDC notes that about 15 to 35% of those infected may not show any symptoms at all. Typically, the incubation period for chikungunya is between 3 to 7 days, with the most common symptom being a sudden fever exceeding 102 degrees Fahrenheit, 39 degrees Celsius. While fatalities are rare, they can occur in severe cases. It's important to note that chikungunya does not spread from person to person through direct contact or saliva. It is solely transmitted through the bite of an infected mosquito. Currently, there is no specific medical treatment for chikungunya infections, although certain therapies can help manage symptoms and any long-term complications. Experts recommend that individuals take preventive measures, such as using insect repellent and wearing long-sleeved clothing to avoid mosquito bites. There are 2 vaccines available for chikungunya. but they are not routinely administered and are only recommended for individuals traveling to areas experiencing outbreaks or those at higher risk of infection. As we navigate this evolving situation, it raises important questions. Are we prepared for another potential outbreak? How should we balance public health measures with individual freedoms? Share your thoughts in the comments below.